And now, a new medical breakthrough has roots right here in Philadelphia. The FDA has approved the first gene therapies to treat patients with sickle cell disease. It's an inherited blood disorder that strikes mainly people of color.
Health reporter Stephanie Stoll has the story of one of the patients who tested the therapy at CHOP.
You feel like somebody is taking a sledgehammer to your bones and hitting it over and over again.
Daniel's Tornano describing what it's like to have sickle cell disease, something he shares with his daughter Marie.
I would feel it in my chest. It's like this hollow burning almost, and then you can't breathe on top of it.
Pain from sickle cell can occur anywhere blood circulates because red blood cells, normally round, bend into inflexible sickle shapes. They pile up inside blood vessels and prevent the normal delivery of oxygen. Complications include bone deterioration, strokes, and organ failure.
I don't think there's a word for it, besides you wishing to just die sometimes.
But the family found hope for Marie at Children's Hospital of Philadelphia, an experimental therapy that her dad didn't qualify for.
I would say in a general way, the impact on the patients has been spectacular.
The FDA has just approved the gene therapy that was tested at CHOP. The patient first has chemotherapy to wipe out any abnormal cells. Then CRISPR technology edits portions of the patient's DNA that enables it to repair red blood cells.
Gene editing is an amazing technique used to actually open up our DNA, making a relatively simple modification and then giving the patient back their cells.
Marie, who's 22 now, started the therapy at CHOP 2 years ago.
The risks were scaring me a little bit, but as we heard more and more about it, I was more and more excited about it.
This is a rebirth. This gene therapy thing is God sent.
Marie, who's a student at Cornell, says she's pain-free now, and her one-time fear of sickle cell being fatal has been replaced with hope.
Now I can see myself living to 80s, 90s. I can imagine the life I'll have for myself. I'm incredibly excited for it.
And Marie tells me she eventually hopes to go to law school. Until now, the only cure for sickle cell disease was a bone marrow transplant. This new gene therapy is being called a real game changer. And the research going on here at CHOP. CHOP was on the ground floor from the beginning with other institutions, but our local team, a big success for them.
Indeed, as we heard, this